Welcome to the video lecture for Unit 2, Module 5.5. In this one, we're going to be talking about fetal and maternal circulation, as well as discuss some of the effects of aging on the cardiovascular system. As always, here are your learning objectives. So let's jump into this one. The fetal cardiovascular system differs from the adult cardiovascular system because the fetus and the adult have different sources of respiratory and nutritional support. Most strikingly, the fetal lungs are collapsed and non-functional, and the digestive tract does nothing to digest. Instead, diffusion across the placenta provides for the respiratory and nutritional needs of the fetus. Blood flows to the placenta through a pair of umbilical arteries. They arise from the internal iliac arteries and enter the umbilical cord. Blood returns from the placenta in the single umbilical vein, bringing oxygen and nutrients to the developing fetus. The umbilical vein drains into the ductus venosus, a vascular connection to an intricate network of veins within the developing liver. The ductus venosus collects blood from the veins of the liver and from the umbilical vein and empties into the inferior vena cava. When the placental connection is broken at birth, blood stops flowing in the umbilical vessels, and they soon degenerate. Remnants of these vessels persist throughout life as fibrous cords. One of the most interesting aspects of cardiovascular development reflects the differences between life of an embryo or fetus and that of an infant. Throughout embryonic and fetal life, the lungs are collapsed. Yet after delivery, the newborn infant must extract oxygen from inhaled air rather than across the placenta. The interatrial and interventricular septa develop early in fetal life, but the interatrial partition remains functionally incomplete until birth. The foramen ovale, or interatrial opening, is associated with a long flap that acts as a valve. Blood can flow freely from the right atrium to the left atrium, but any backflow closes the valve and isolates the two chambers from one another. Thus, blood entering the heart at the right atrium can bypass the pulmonary circuit. A second short circuit exists between the pulmonary and aortic trunks. This connection, the ductus arteriosus, consists of a short muscular vessel. With the lungs collapsed, the capillaries are compressed and little blood flows to the lungs. During diastole, blood enters the right atrium and flows into the right ventricle, but it also passes into the left atrium to the foramen ovale. About 25% of the blood arriving at the right atrium bypasses the pulmonary circuit in this way. In addition, more than 90% of the blood leaving the right ventricle passes through the ductus arteriosus and enters in the systemic circuit, rather than continuing into the lungs. Here I just want to talk about some of the congenital heart problems that we can see upon delivery. So most of the congenital heart problems result from an abnormal formation of the heart or problems with the connections between the heart and the great vessels. Here you can see the normal heart structure. If the foramen ovale remains open or patent, blood recirculates to the pulmonary circuit instead of entering the left ventricle. The movement, driven by the relatively high systemic pressures, is called a left-to-right shunt. Arterial oxygen content is normal, but the left ventricle must work harder than usual to provide adequate blood flow to the systemic circuit. Hence, pressures rise in the pulmonary circuit. If the pulmonary pressures rise enough, they may force blood in the systemic circuit to the ductus arteriosus. This condition, a patent ductus arteriosus, creates a right-to-left shunt. Because the circulating blood is not adequately oxygenated, it develops a deep red color. The skin then develops the blue tones typical of cyanosis, and the infant is known as a blue baby. The tetralogy of Fallot is a complex group of heart and circulatory defects that affect about 0.1% of newborn infants. In this condition, 1. The pulmonary trunk is abnormally narrow, which is pulmonary stenosis. 2. The interventricular septum is incomplete. 3. The aorta originates where the interventricular septum normally ends. And 4. The right ventricle is enlarged, and both ventricles thicken in response to the increased workload. A ventricular septal defect is an abnormal opening in the wall, or the septum, between the left and right ventricles. It affects about 0.12% of newborns. The opening between the two ventricles has an effect similar to a connection between the atria. When the more powerful left ventricle beats, it ejects blood into the right ventricle and the pulmonary circuit. In an atrioventricular septal defect, both the atria and the ventricles are incompletely separated. The results are quite variable, depending on the extent of the defect and the effects on the atrioventricular valves. This type of defect most commonly affects infants with Down syndrome, a disorder caused by the presence of an extra copy of chromosome 21, also known as trisomy 21. In the transposition of the great vessels, the aorta is connected to the right ventricle instead of to the left ventricle, and the pulmonary artery is connected to the left ventricle instead of the right ventricle. This malformation affects about 0.05% of newborn infants. Let's talk about some of the effects of aging. So the capabilities of the cardiovascular system gradually decline. As you age, your cardiovascular system undergoes the following major changes. Age-related changes in blood may include 1. A decreased hematocrit, 2. Constriction or blockage of peripheral veins by a stationary blood clot called a thrombus, which can become detached, pass through the heart, and become wedged in a small artery, commonly in the lungs, causing a pulmonary embolism. And 3. Pulling of blood in the veins of the legs because valves are not working effectively. Age-related changes in the heart include 1. A reduction of maximum cardiac output, 2. Changes in the activities of the nodal and connecting cells, 3. A reduction in the elasticity of the heart or fibrous skeleton, 4. Progressive atherosclerosis that can restrict coronary circulation, and 5. Replacement of damaged cardiac muscle cells by scar tissue. Age-related changes in blood vessels may be linked to arteriosclerosis. 1. The inelastic walls of the arteries become less tolerant of sudden pressure increases, which can lead to an aneurysm, whose rupture may, depending on the vessel, cause a stroke, myocardial infarction, or a massive blood loss. 2. Calcium salts can be deposited on weakened vascular walls, increasing the risk of a stroke or myocardial infarction. 3. Lipid deposits in the tunica media associated with a damaged endothelial lining and calcium salts can form atherosclerotic plaques. And 4. Thrombi can form at the atherosclerotic plaques. And finally, keep in mind that the cardiovascular system is both anatomically and functionally linked to all other systems.